There's a good chance that people who are at high risk for the coronavirus are the kinds of folks who have routine doctor's appointments. The hope is that they will consider telemedicine to avoid getting sick while they're trying to get well. Here's Anusha Roy.
Let's start with who's at risk. The group includes older adults and anyone at any age with chronic health conditions, including lung and heart disease, and those who are immunosuppressed.
But we don't want people taking unnecessary risks.
So doctors within Kaiser are clear about their strategy when it comes to keeping routine doctor's appointments in the midst of COVID-19.
We really are taking a virtual first approach.
So how would that work for, let's say, a physical?
A lot of it is really about screening,
which could be done over the phone, video chat, or even online chatting. You can also ask your doctor if it's safe for you to come in for lab work. And if you are not in a high-risk group, you can have this same conversation about telehealth with your doctor.
So we can decide if there are symptoms or issues going on that they need to come in and be seen.
This week, the state told insurance companies to remind members telehealth is an option. The Colorado Association of Health Plans says the cost is similar to an in-person visit and in some cases free, depending on your plan.
Those who do have that capacity are definitely stepping up.
Mental Health Colorado said this applies for behavioral health appointments too in the right circumstances.
Medicine can work well, especially once someone has an established relationship with a provider.
But for both medical and mental health emergencies, 911, an emergency room, and seeing a doctor in person is still necessary. And while telehealth is being looked at as a good option to reduce risk,
in order to make sure that care is accessible,
it comes with a few limitations, like parts of rural Colorado that may not have strong enough internet to support a video chat with the doctor, and there's the concern doctors may not get reimbursed enough to cover their costs. So if you think you may have been exposed to COVID-19, may have it, it is really important that you call your doctors first to get directions on where to go, what your next steps should be, where you can get tested. And that includes calling before you go to the emergency room, and that goes for all age groups. And the state has instructed insurance companies right now to provide any telehealth services for COVID-19 prevention specifically for free. You should not be having to pay a copay for that right now.
Copays obviously for folks with insurance. For folks without insurance who are being told, take your doctor's note to one of these private providers, and they don't have a doctor.
Yeah, so the state said that if you don't have insurance, you can actually go to one of their drive-up testing centers. You have to show some kind of ID, photo ID, doesn't have to be government issued. You're probably not going to have a doctor's note, right, if you don't have a doctor or insurance. So you're going to meet with a nurse or an epidemiologist on site. They are going to decide that if you meet the criteria to get that test done, if you do need the test, and if you have to have that meeting, all of that, the state is saying, is for free.
And just so folks know, they can't use that system, show up with an ID, to shortcut the test. Those people are going to be turned back to a doctor to go and get the note. It's not a shortcut. It's just for folks without insurance. All right.
Absolutely.
Thank you, Nusha. Appreciate it. Tens of thousands of Coloradans are moving much of their lives online. Work, school, Netflix prior to chilling. Some of you have asked us whether we have the bandwidth for so much online activity. MSU professor Steve Beatty said internet providers really have built out service for our state's future population.
Internet service providers, be they phone or cable, I think they have quite a bit of bandwidth available, and so they probably haven't essentially at this point maxed out. They've overbuilt, which I think is a very good thing clearly at this time.
Now keep in mind, people living in more rural parts of Colorado may not have the fastest internet connection, so they could be seeing more issues compared to the metro area.